What I'm about to explain could completely change how you understand the blood pressure medication sitting in your home right now, because for millions of people taking drugs like Amlodipine, Losartan, or Lisinopril, there's a hidden gap in understanding that can quietly turn a simple, manageable side effect into something far more serious if it goes unnoticed. The problem is rarely that these medications are prescribed incorrectly. It's that people are not fully shown what their bodies are supposed to feel like while taking them, so they end up dismissing important warning signs as stress, aging, or just a bad day. By the end of this, you'll understand which reactions are expected, which ones need attention, and which ones should never be ignored, even if they seem small at first. To make this real, let me start with a patient I'll call Gloria. She was 72, careful with her health, consistent with her treatment, and exactly the kind of patient any clinician appreciates. Her blood pressure improved nicely after starting treatment, and on paper everything looked stable. But a few months later, she came in noticing her shoes felt tight by evening, her ankles were swelling, and she felt unusually heavy as the day went on. She assumed it was weight gain, maybe her heart, or just aging. What she didn't know was that her medication was directly responsible for a very specific effect that can easily be misunderstood if no one explains it properly, and that misunderstanding is exactly where the risk begins. Number 11 is where the first major misunderstanding usually starts, and it's the idea that all blood pressure medications behave the same way. They don't. Even though Amlodipine, Losartan, and Lisinopril all lower blood pressure, they work through completely different biological pathways, and that difference shapes the side effects people experience. Amlodipine often relaxes blood vessels in a way that leads to swelling in the lower legs. Lisinopril is well known for triggering a persistent dry cough in some patients. Losartan is often chosen as an alternative when that cough becomes intolerable. Same goal, different mechanisms, and very different signals from the body. The problem is what happens when people don't know this. Someone develops a cough on Lisinopril and assumes every blood pressure drug will do the same, so they stop treatment entirely. Someone else develops ankle swelling on Amlodipine and assumes their heart is failing, creating unnecessary panic. And another person feels fine on Losartan and assumes nothing needs monitoring, when in reality subtle issues like potassium changes can still develop quietly. Once you understand the class of medication, the body's reactions stop feeling random, and that clarity alone can prevent a lot of avoidable fear and poor decisions. Number 10 is exactly what Gloria experienced without realizing it. Amlodipine can cause ankle and leg swelling, and it's one of the most commonly misunderstood effects in this category. People often blame salt intake, kidney problems, or inactivity, but the mechanism is more specific. The small arteries relax more than the veins, so fluid shifts into surrounding tissues, especially in the lower legs where gravity plays a role. That's why symptoms often appear as the day progresses, with socks leaving marks by evening even when things look normal in the morning. Arthur's experience shows how easily this can be missed. He was 76 and noticed his ankles swelling later in the day, improving overnight, then returning again. He assumed it was normal aging and never connected it to the Amlodipine he had started weeks earlier. Over time, the discomfort increased, but he didn't want to bother anyone, so he kept going. Eventually, embarrassment about the swelling led him to skip doses when going out, which is where a manageable side effect quietly turns into unstable blood pressure. The swelling itself isn't always dangerous, but ignoring it or misinterpreting it absolutely can be. Number 9 shifts to another symptom that people often normalize for too long, the dry cough linked to Lisinopril. This cough doesn't always appear immediately. For some, it starts within days, for others weeks, and in some cases even months later, which is why the connection is often missed. People blame allergies, reflux, or a lingering cold because the cough feels dry, persistent, and irritating, but not obviously severe. Helen's story makes this clear. Months after starting Lisinopril, she developed a throat tickle that turned into nighttime coughing that disrupted her sleep and drained her energy. She tried changing her environment, medications, and habits, but nothing helped. What she hadn't been told was that this type of cough can appear late and is directly linked to the medication. The important point, though, is that while this cough is frustrating, it is usually not dangerous. However, there is a critical distinction here that cannot be ignored. Swelling of the lips, tongue, face, or throat, especially if it affects breathing or swallowing, is not a mild side effect. That can indicate angioedema, a rare but serious reaction associated mainly with ACE inhibitors like lisinopril and very rarely ARBs like losartan. That situation requires immediate emergency care, not waiting or monitoring. Understanding the difference between a nuisance symptom and a true emergency is essential. Number 8 focuses on something many people overlook entirely: potassium. Both losartan and lisinopril can increase potassium levels in the blood. And that matters because potassium directly affects heart rhythm. Most people think this only comes from supplements, but potassium is also found in salt substitutes, electrolyte drinks, and even so-called healthy seasoning blends. Robert's experience shows how easily this becomes a hidden risk. He switched to a salt substitute thinking he was helping his heart, while also taking losartan, unintentionally increasing potassium from multiple sources. Over time, he developed weakness and irregular heartbeats, and blood tests later revealed elevated potassium levels that required urgent correction. He wasn't careless, he was misinformed. And that gap is where problems often begin. Number 7 is about kidney numbers. And it's one of the most misunderstood parts of starting medications like losartan and lisinopril. These drugs can slightly change kidney lab values early on, such as creatinine or eGFR. To patients, that can look like damage, but in some cases it's an expected shift due to how kidney blood flow is regulated under these medications. Sharon nearly stopped her treatment after seeing a small change in her lab results. She assumed the medication was harming her kidneys. But the key was not just the number itself, but the size and pattern of change. Under medical supervision, mild shifts can be acceptable or even expected, while dangerous trends are something entirely different. Without that context, people often stop medications that are actually protecting them long-term. Number 6 highlights a situation that can change everything quickly: dehydration. When someone is taking losartan or lisinopril, illness, vomiting, diarrhea, or heavy sweating can dramatically alter how the body responds to the same dose. Blood pressure may drop too far, kidneys can become stressed, and dizziness or fainting can appear suddenly. Frank experienced this during a stomach illness. He kept taking his medication while dehydrated and later felt severe dizziness when standing. The issue wasn't the medication itself, but the change in his body's fluid balance. This is why sick day rules matter, because the same dose does not behave the same way in a depleted body. Number 5 involves a hidden but very common interaction over the counter pain medications like ibuprofen or naproxen. When combined with lisinopril or losartan, especially alongside diuretics, they can reduce kidney blood flow and increase risk of injury. The danger is that each medication seems harmless on its own, but together they create strain on the kidneys. Carol's situation showed this clearly. She used ibuprofen regularly for arthritis while on blood pressure medication and a water pill without realizing the interaction. Once identified and adjusted, her condition improved. But the key lesson is that over-the-counter drugs are still powerful and need the same level of awareness as prescriptions. Number 4 is dizziness, a symptom many people dismiss until it leads to a fall. When starting or adjusting doses of amlodipine, losartan, or lisinopril, blood pressure can drop more than the body is used to, especially when standing up quickly. Joseph experienced this at night when he stood up too fast and nearly fell. He had been told the medication could lower blood pressure, but not what that would feel like in real life. That lack of preparation is often what turns a manageable adjustment period into a safety risk. Number 3 is about interpreting readings. A single blood pressure reading doesn't define whether treatment is working. Blood pressure naturally fluctuates with stress, sleep, posture, caffeine, and even anxiety about measuring it. Judging medication success based on isolated numbers leads many people to unnecessary fear or overreaction. Diane checked her blood pressure repeatedly whenever she felt uneasy, which created a confusing pattern of readings that made her believe her medication wasn't working. Once measurements were standardized and taken calmly, the truth became clear. The medication was working, but her method was creating noise. Number 2 is about timing and consistency. These medications are designed for steady use, not reactive changes based on daily readings or fear. Missing a dose should not lead to doubling up unless specifically instructed, because that can cause sudden drops in blood pressure and unwanted symptoms. Martin learned this after occasionally doubling doses or taking extra tablets when he felt worried about his readings. Instead of stabilizing his condition, it made him feel worse. These medications are not emergency tools. They are long-term stabilizers that depend on consistency. Finally, number 1 is the most important idea of all. The best blood pressure medication is not the one that produces perfect numbers temporarily, but the one you can safely tolerate long-term in your real life. That means balancing effectiveness with side effects, lifestyle, lab results, and overall comfort. Teresa's case brings this together. On paper, her blood pressure was well controlled on lisinopril, but she developed a persistent cough that affected her sleep and quality of life. She didn't speak up because she assumed it was something she had to accept. Over time, she began missing doses and eventually stopped altogether, which led to her blood pressure rising again. Once the cough was recognized as medication-related, adjustments could be made. The key lesson is that side effects are not personal weakness. They are clinical information. Swelling, cough, dizziness, fatigue, and lab changes all provide data that help guide safer treatment. The goal is not silence or endurance, but communication and adjustment when needed. In the end, many people live with these medications without fully understanding how they work or what their bodies are trying to signal. That gap creates fear, and fear leads to poor decisions. But once you understand the mechanism behind the symptoms, everything becomes clearer, and you move from confusion to informed awareness. And that understanding is what ultimately makes treatment safer, more stable, and far more sustainable in the real world. The most important shift happens when you stop treating these medications like something you just take and forget, and start seeing them as something you actively understand and respond to. Because once that understanding is missing, people fall into two dangerous patterns. They either ignore symptoms that are actually important, or they panic over changes that are completely expected. Both lead to poor decisions, and both come from the same root problem: lack of context. This is why so many patients feel like they're guessing with their health. They know the name of the pill, they know the dose, but they don't know how it interacts with hydration, kidney function, diet, or even simple daily habits like standing up too quickly or taking over the counter pain relief. That missing context is what creates fear, and fear is what leads people to either stop medication silently or take it in unsafe ways. What changes everything is learning to read your body correctly. Not overreacting to every small symptom, but also not dismissing patterns that keep repeating. For example, occasional mild dizziness when starting amlodipine can be part of adjustment, but repeated near fainting is not something to ignore. A short-lived dry cough with lisinopril may be tolerable for some, but a cough that disrupts sleep and persists for weeks becomes a quality of life issue that needs attention. And with Losartan, feeling generally fine doesn't mean ignoring labs that monitor potassium and kidney function. The real skill here is interpretation. Not panic, not denial, but interpretation. And interpretation becomes much easier when you understand what class of medication you are on and what patterns typically come with it. Without that, every symptom feels random. With it, your body becomes readable instead of confusing. Another important truth is that many people unintentionally make things worse by trying to correct their medication on their own. They skip doses when they feel fine. They double doses when they feel anxious about a reading. Or they stop completely when a side effect appears without realizing there may be an alternative within the same treatment plan. None of these decisions come from carelessness. They come from fear and lack of guidance. But blood pressure medication doesn't work like pain relief where you take it when needed. Drugs like amlodipine, Losartan, and lisinopril are designed for long-term stability. They build control over time. When they are interrupted, adjusted randomly, or taken inconsistently, the body doesn't get a stable signal anymore, and that instability can itself become the problem. That's why consistency is not just a recommendation. It's part of the treatment. Same routine, same timing, and clear instructions for what to do when something goes wrong. Because guessing in the middle of treatment is where most preventable side effects or complications begin. And there's something else that often gets overlooked. Your lifestyle context changes how these medications behave. Illness, dehydration, heat, diet changes, and even sudden increases in activity can shift how your body responds. A dose that feels perfectly normal one week can feel too strong the next if your fluid balance or health status changes. That's not failure of the medication, that's the body changing its conditions. This is exactly why communication matters. Not waiting until something becomes severe, but recognizing early signals and speaking up before they escalate. A mild symptom that lasts is always more important than a dramatic symptom that appears once. Patterns matter more than moments. At the center of all of this is a simple idea that gets lost too often: side effects are not personal weakness, and they are not reasons to feel alarmed in isolation. They are information. Swelling tells a story. Cough tells a story. Dizziness tells a story. Lab changes tell a story. And your job is not to diagnose yourself, but to make sure that story is heard early enough to be managed safely. Because the real danger is not usually the medication itself. It's silence, confusion, and misunderstanding of what your body is trying to communicate while you're taking it. Once that gap is closed, these medications become far safer and far more predictable. And that is the core message here. You don't need to fear amlodipine, losartan, or lisinopril, but you do need to understand them. Because understanding is what turns confusion into control, and control is what keeps treatment safe in the long run. If this message reaches someone who is currently taking blood pressure medication without fully understanding what to expect, it could change how they manage it going forward. And sometimes that understanding is exactly what prevents a small issue from turning into a serious one later.